The purpose of this DVD is to simulate the examination experience, not to teach each individual test procedure.
As the current chair of the Commission on Optometric Staff Certification, I'm excited about the current primary role that optometrists play in the delivery of eye care and the increasing utilization of optometric assistants to help to deliver this care. The AOA 2020 Future Conference Summit recognized the importance of this role. And I want to congratulate each and every one of you for preparing for and scheduling to take this career step towards becoming a certified optometric technician. I commend your personal commitment and the support you have received to study all that is required to be successful. The Commission has worked years with doctors of optometry, office staff, industry liaisons, and current CPOTs to design a fair, professional, and worthwhile practical design to raise the optometry profession. Test format can be likened to the National Board of Examiners' practical exam procedures taken by all doctors of optometry. It is our hope that our efforts will reward you with personal acknowledgement that will raise your self-esteem and increase the success of your choice of optometry as a career. We would like to thank CIBA Vision for their generous support over the past 4 years with money, the terrific talent of Craig Ferreter, who is an employee of CIBA, and the pursuit of excellence in this endeavor, such as the training presentation you are about to watch.
Please read and review the complete candidate guidebook before taking the examination. It has been designed to help you prepare for this examination. A copy of this guidebook is also located on the CD Toolkit. Arrive at least 1/2 hour before testing begins to complete your exam orientation. Be prepared to present your photo ID to the exam administrator at the test site. You will be assigned a candidate badge with your ID number at that time. You will be directed to where and which order you will report to each of the stations. Treat your patient as you would in your office with courtesy and respect. Include positive nonverbal communications. You will be expected to not engage in any distracting conversations with the patient, examiner, or other candidates. Direct any questions you have to the examiner before the exam is started. If the safety of the patient is compromised, the procedure will be terminated at the discretion of the examiner. Candidates should present themselves at the exam with clean fingernails no longer than 3 millimeters beyond the nail bed. Remember, bring your experience, valid test admission material, and one photo ID. You will be briefed as a group before the practical by the exam coordinator prior to the examination, and individual questions can be asked at that time.
Okay, very good. Hello, my name is Tammy Franklin. I am the site coordinator and the test administrator for this exam. I'm here today to welcome you and thank you for coming and taking this next step in your certification levels. I want to make sure that you ask me any questions that you may have, and I'll answer those questions today for you.
Beginning the examination, report to your first assigned room with an ink pen. You will be given a clipboard and a blank recording sheet. Be ready to ask clear, concise, and complete questions. You will need to memorize the major case history areas. Remember to record all findings and procedure information. Station 1, Station 2, Station 3, Station 1, room orientation and setup. Take the time in your assigned room to inventory your equipment. Check for the occluder, near-point card, stereopsis test, and don't forget the Polaroid glasses. Color vision test, ocular motility targets, transilluminator, and pen light. Clean equipment. Familiarize yourself with the room. Check the cleanliness of the area. Take the time to pre-clean the occluder and other instruments that might come in close contact with the patient. Check that the Polaroid glasses are in good condition. Familiarize yourself with the room. Take note of how the room lights work and check the room lighting. Make sure you understand how the overhead lamp works and how to operate the examination chair, including the headrest. Check that the acuity chart is working properly and that you know how to operate it. Take the time to wash your hands and get ready for the whistle to blow. Familiarize yourself with the forms used. There are examples on the CD-ROM toolkit. Just before your exam begins, a loud whistle will sound. Do not start until you hear the whistle. At this time, the examiner will enter the room. Station 1. Case History and Pre-Testing Skills. This can be found on the Toolkit CD-ROM. Please be sure to follow the questioning format as outlined on the examiner score sheet.
Good afternoon.
The video you
I'm
are
gonna
about
be
to
your
watch
technician today,
is for
and I
demonstration
just wanna ask
purposes
you a few
only.
questions
It is
before
not
you
the complete
actually see the
case
doctor,
history.
Get some information, and first of all, I want to start out with what brought you into our eye clinic today.
My arms are just too short. I can't see things as clearly as I'd like to.
Okay, and is that
You will be expected to follow the history sequence as outlined in the exam materials and to ask appropriate follow-up questions. The examiner will be scoring you on how well you perform using the same score sheet you have just seen on the screen. Make sure you cover all aspects of the history, including chief complaint, ocular history, and health history.
Okay, now we're going to go ahead and check your
Start each procedure with an explanation to the patient. You are to start with unaided distance visual acuity.
And read the lowest, clearest line you can.
NRFDVS.
You go ahead and read.
Record each of your findings on the candidate recording sheet. Then move on to the distance aided acuity.
FED.
Okay.
Better.
Okay, go ahead and read the lowest, clearest line.
LYECF.
Okay. And again, lowest, clearest line.
TBL.
Once these are recorded, proceed to measure near unaided and aided acuities. Remember to adjust the lighting appropriately.
When I saw a dog.
Okay, and again, lowest, clear. Let's have you go ahead and let me record that.
This is much better.
Okay. But at this distance, it's a
Oh,
little hard.
it is.
Okay.
I walked up to this.
And check to see how well you see.
Next, measure stereopsis, applying the Polaroid glasses either without or with the patient's glasses as needed.
Oh my, I do.
A fly can pinch his wings. Good. And what do you see in this circle?
An L and an R.
Okay, good. And over here, Now we're going to go ahead and check for your color vision.
Now proceed to evaluate the patient's color vision. Remember to do this monocularly and to record your findings correctly.
So, just go ahead and cover your left eye, and I'll hold the book, and you tell me which number you see in the circle. Go ahead and just hold
Ocular motility is the next pretest. Align yourself at eye level with the patient and hold your target at 15 inches. Make sure the patient follows the target with her eyes rather than by turning the head. Record your findings.
So now we're going to go ahead and check to see.
Confrontation visual fields should then be assessed. Again, aligning yourself with the patient's eyes.
Straight into my eye. If you will go ahead and cover your left eye, we'll do your right eye first, and I'm going to cover my.
To start,
right eye.
explain the test briefly to the patient. Make sure the patient's eye is fully occluded while you occlude your own eye, opposite that of the patient's.
I see it.
Okay, and go ahead and change eyes. Let's try again. Do you see my fingers? Okay.
I see it.
Once completed, record your findings as shown in this example.
I see it.
Okay. All right. Now I'm going to go ahead and check for how your eyes react to light and how your pupils are responding. So I need to go ahead and have you look at the.
For pupil testing, make sure that lighting is appropriate.
Go ahead and look over my shoulder to the big E. And then I want you to go ahead and look number 1.
Okay, I do.
Good.
Be sure to test the near response as well as the direct and consensual light responses, watching the pupils carefully as you do. The examiner will be watching to see you are doing this appropriately. You will next perform the unilateral and alternating cover tests. Again, make sure you are covering completely, your patient is fixating appropriately, and that you are noting any eye movement. Repeat the tests for near and record your findings. Remember that this is a timed examination, so you must be organized and move smoothly from test to test. Whistle blows to end Station 1. The examiner leaves the room. Report to your next assigned room. Station 2. Blood pressure, contact lens, tonometry, pachymetry, and drops installation. You will be given the opportunity to familiarize yourself with the equipment at Station 2. Take the time to wash your hands and get ready for the whistle to blow.
Okay, now we're going to go ahead and check your blood pressure. Leave it in.
When taking the blood pressure, make sure the patient's arm is level with the heart. Take your reading efficiently and record your findings, including time and date. Take the time to wash your hands. The first procedure at the station will be to insert a pair of soft contact lenses on your patient's eyes. Again, prepare the patient by explaining what you are about to do. Make sure to give the patient appropriate instructions regarding where she is to look and how it should feel. You are limited to 3 attempts for each eye. For any part of this test, if the examiner feels the patient's safety is in question, he or she will ask you to stop the procedure. With the soft lenses still on the eye, you will now proceed to taking measurements with the tonopen and the pachymeter. Check the calibration of the tonopen and make sure you have the protective cover properly positioned. Explain the procedure to the patient, then take a measurement on each eye. Be sure to hold the tono pen perpendicularly to the central cornea. Record your results. You will then take measurements with the digital pachymeter. You should check to make certain the soft contact lens is still in place before proceeding. Clean the probe tip properly, explain the procedure and purpose to the patient. Take a measurement on each eye by touching the probe gently at the center of the cornea. Record your findings. You will next insert and remove a rigid contact lens on one eye, still leaving the soft lens in place. Select and use the proper solutions for cleaning, rinsing, and wetting the rigid lens. Inspect the lens to be sure it is clean and has no flaws, such as a chipped or cracked edge. Explain the process to the patient and instruct her where to look. Place the lens so it is centered on the eye and instruct the patient again regarding direction of gaze. Next, proceed to remove this lens by manipulating the eyelids. Again, remember to direct the patient on where to look. In some instances, the soft lens may come out with the rigid lens. Do not be concerned if this happens, as the next step is to remove the soft contact lens. In the next procedure, you will simulate the process for dilating a patient's eyes and demonstrate your technique for instilling eye drops. The drops used in this examination are artificial tears that have been labeled to represent drops used in practice. You will be expected to know which drops to use and in what order if you are going to actually dilate the patient. Select the first medication and instill one drop in each eye of the patient and block the tear drainage by pressing on the inner canthus. Document the drops you used as shown. Station 3. Lensometry, base curve, and pupillary distance. You will have the opportunity to familiarize yourself with the equipment at this station. Do not start any of the procedures until the whistle blows again. Turn on the lensometer and proceed with neutralization of the Single Vision RX. Before putting the glasses on the stage, first focus the eyepiece and check that the lensometer is calibrated. Proceed in order to neutralize first the right, then the left lens. Be careful to record your findings properly on the examination sheet. Measure and record the base curve of the lenses. Again, right lens first. Take care to not scratch the lenses, and record your findings. Markup and verification of progressive addition lenses. It is a good idea to start by cleaning the progressive lenses so it is easier to identify the markings. Locate and mark the engravings. Then complete the markup of the lenses using the manufacturer's template. Once the lenses are marked up, verify the lenses, starting with the right. Carefully record your findings. Pupillary distance measurement. You will then measure the examiner's pupillary distance using the pupillometer, demonstrating that you know how to use this instrument accurately and efficiently. You will need to measure monocular PD for both distance and near and record properly. The whistle will blow one last time to signal the end of the examination. The examiner leaves the room. Report to your clinical coordinator for a general debriefing of your examination.